The following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
And welcome to Community Psychiatric Centers Presents All About Autism. Tonight we begin a very special series of programs that answer some very important and timely questions about autism, which now affects more than 500,000 children in this country. What is autism? Who does it affect? And what kinds of treatments are available to help? Tonight, we're joined by two experts in the field. They are from Community Psychiatric Centers, which is a full-service mental health agency that specializes in the evaluation, treatment, and support of children, teenagers, and adults. First, joining us is Dr. John Carasso. Dr. Carasso is the clinical director of Community Psychiatric Centers. He is a clinical licensed child psychologist and a certified school psychologist. And next to him is Dr. Robert Lowenstein, who is medical director of Community Psychiatric Centers. He is a board-certified child, adolescent, and adult psychiatrist and is a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Thank you.
Thank you for joining us. Dr. Lowenstein, let's start with you. What exactly is autism? We hear so many different things about it, and there's such a broad spectrum. What is it?
Autism basically is a developmental disorder that affects children, usually starting with the age of 3, that has 3 major components associated with it. First would be problems with socialization. Second would be problems with communication of feelings or thoughts. And third are problems with need for repetitive behaviors, activities, which impact on the child's life.
And this is it growing in prevalence, or are we just diagnosing it more?
Well, the rates are increasing every year. It was just reported to affect 1 in 150 children in the United States. The rates have gone up steadily every year. It's unclear as to why the rates are going up to the rates that they are, but it clearly affects a great number of children. Over 560,000 children are diagnosed with it currently.
Dr. Carasso, what about the need for early intervention? Why is that so important?
What's the key? It really is. And one of the primary purposes of this show, of us doing this show, is to educate families and parents so that they're better able to recognize and understand the symptoms should they occur, so that then they can get their children into service quicker, and that lends to a better prognosis or a better outcome. It's almost a paradox. We spoke of the increased rates, but we still get children in for initial evaluations at 6, 7, 8 years of age. We prefer it to be younger, 2, 3 years of age.
Can it be critical if that time lapses and a child does not get the treatment that they need?
All children can be helped, and without question, but clearly, younger the better. They tend to respond better the younger they are.
Were you surprised when you saw the study about the prevalence increasing?
Well, it's been increasing now for quite some time. Back in the mid-'80s, it was 1 in 2,500 or something, and then it went down to went up to 1 in 165. And it does seem to be increasing. The question is why, and that's the ongoing dilemma and question as to what this is all about.
All right, we're going to be answering a lot of those questions tonight and over the next couple of weeks. You're watching Community Psychiatric Centers Presents All About Autism. Stay with us.
Have you noticed something different about your child lately? Does your child seem withdrawn, unhappy, depressed, or prone to sudden outbursts? Your child may be suffering from a mood disorder, and it may be time to get help. At Community Psychiatric Centers, Dr. Robert Lowenstein and Dr. John Carasso lead a highly trained professional staff that offers mental health diagnosis, treatment, and therapy to children and adolescents. Call 1-877-899-6500 today for a free phone consultation.
You'd think it would be easy to tell which kids have trouble with their eyesight.
Here, kitty, kitty. Here, kitty, kitty.
But that's not always the case. Even though 1 in 4 children may have a vision problem, eye doctors tell us the symptoms aren't always so obvious. For clues on how to spot the real-life signs of childhood vision problems, visit checkyearly.com. A public service message from the Vision Council of America, and reading is fundamental.
Welcome back to Community Psychiatric Centers Presents All About Autism. Let's get right to some questions about the signs and symptoms of autism. Dr. Lowenstein, let's talk about what a parent or a grandparent or a teacher might see that would kind of tip them off that there's something going on with this child.
Right. Autism can probably be diagnosed as early as 18 months of age. At that time, children often display some of the 3 characteristics I mentioned before, but the most important thing to look for in younger children is that they're not speaking when they should, and they're not able to interact with others appropriately. Like, for example, they're not able to point to objects in order to show their interest in them to their parents or others. They seem not to enjoy social interaction with peers or their siblings, and they appear to be uninterested in people in the room. Some parents complain that their children appear deaf, but they're not, because they respond to other sounds that are pleasurable to them.
There's really a broad spectrum of autism.
Yes.
I think the thing that probably caught everyone's attention when the 17-year-old high school senior,
Yes.
Jason McElwain in New York, comes off the bench and he hits 6 3-point shots in a row.
Right.
And everyone says, he's autistic?
How can that be?
How can it be?
Yes.
Do you get this all the time?
Sure. Autism is considered to be a spectrum disorder, and it's a commonly used term, but often misunderstood. The term spectrum can be conceptualized really in 2 different ways. One, diagnostically, in that on one end of the spectrum or continuum, there's autistic disorder, which is quite severe. At the other end of the spectrum is Asperger's disorder, which is predominantly social deficits. Now, many children do not meet the specific criteria necessary for autistic disorder or Asperger's. So there's a middle ground called pervasive developmental disorder, or PDD. And if a parent is informed by a practitioner that their child is functioning within the spectrum, well, that's a rather ambiguous way of putting it. It could be any one of those diagnoses, so it's important for a parent to obtain specific information as to where along that spectrum the child may fall. The spectrum can also be seen or be understood to represent the wide variation of children within the spectrum in terms of, well, in a few moments we're going to see video clips of 2 children. One Nathan and the other one's Brittany. Both children are diagnosed within the spectrum, Nathan with autistic disorder, Brittany with PDD, and we'll see, while both of them are within the spectrum, they function very differently.
Do these children often get misdiagnosed?
Well, yes, they do. Actually, it's a shame, but a lot of these children do not get diagnosed at all until they're 6 or 7 years old. There also are a lot of symptoms associated with autism spectrum that can be diagnosed in other conditions. So there are symptoms like hyperactivity, aggression, problems with cognitive skills, which can carry other diagnoses instead of autism when they're really autistic.
So it really takes a lot of work to do the evaluation to really correctly diagnose what's going on.
Well, it's true. You know, as we're going to see in the upcoming video clips, the signs and symptoms can be quite subtle, and it's important to have an experienced practitioner working with the parent and the family and the child to make sure that the diagnosis is accurate and treatment is timely and efficient.
And it's important to also add that the earlier it can be diagnosed and treated, the better.
Definitely.
that the prognosis is greatly improved if early intervention occurs.
What are some of the early things that can be done in terms of early
Well, interesting.
intervention?
In shows to come, we're going to be discussing various treatment modalities, discrete trial therapy, social-based interventions. We'll take a look at speech and language therapy, occupational therapy, and the pros and cons of each, and they can be very effective.
All right, we're going to take a short break. When we come back, we will be joined by a woman whose son was diagnosed with autism at the age of 2 years. He's now 11 years old. We'll have her story and his story when we come back on Community Psychiatric Centers Presents All About Autism.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
And welcome back to All About Autism. We are talking tonight with Dr. John Carasso and Dr. Robert Lowenstein of Community Psychiatric Centers about autism, what it is, how it affects families and children, parents, grandparents, teachers, people in the community. Joining us now, as promised, is a woman who knows this subject very well. Sondra Cheek, her son Nathan, was diagnosed at the age of 2. Is that correct?
Yes.
Sondra, welcome to the show.
Hi.
Tell us a little bit about Nathan and what you noticed in the very beginning that made you want to take him in for an evaluation.
My son Nathan is 11 years old right now. In the very beginning, I know a lot of parents see signs at different ages, different stages. With Nathan, we noticed so many things from a very young age. So many milestones he didn't have, the rooting reflex, didn't crawl, those types of things. Obviously, the big signs were the language, but it was so much more than he didn't speak. He didn't seem to understand things too. His receptive skills were very poor. He didn't know his own name. There were so many things like that. He had no play skills at all. Instead, he would line objects up, that type of thing, and lots of repetitive motions.
Dr. Lowenstein, tell us a little bit about what we're going to see. We have some tape of Nathan. Kind of set up what we're going to be looking at.
Well, you're going to see a child with severe autism who displays all of the classical symptoms of autism, as she stated, both with communication problems, social problems, and problems with repetitive and unusual interests and behaviors. The tape is pretty descriptive of that.
All right, let's take a look at it now. Sondra, tell us, this is a recent tape, correct?
Yes, this was literally a couple weeks ago. This is in my living room.
And we can see self-stimulatory behaviors with the picture cards, right?
Right. These are drawings of Blue's Clues that he really likes. He's very protective of them when he wants them. And you will see in a little bit he drops a picture, and then he gets a little bit upset over that.
Because he finds them to be soothing, right? They're very important to him.
Absolutely, absolutely. Actually, I actually prefer that he has them if we go to a doctor's appointment or an outing, because I know that will help occupy his time rather than him hitting himself or hitting other people, getting aggressive.
And when he's upset, he's not able to communicate his feelings verbally to you.
No, Nathan's 11 years old and he is still completely considered nonverbal. He has about 20 words that he knows of the English language, but those are still rough. They're not concrete words that he knows in every setting.
And if he were approached at this point, how would he respond to that?
Nathan only bothers with people if he needs something from them. Other than that, he really has no use for outside people.
Yes.
That hopping and skipping that you're seeing is also pretty indicative of this disorder often.
Absolutely. Nathan does not sit still even to eat. Even if Nathan's eating lunch or dinner, he's either up jumping and moving around literally while he's eating. I've seen him eat a full chicken dinner while hopping on the trampoline. Nathan does not sit still.
How much of a challenge has this been for the family unit, for all of you?
Well, it definitely impacts every single person in your house. Our life revolves around Nathan and Nathan's schedule. It's just the way that it is. Whether it's my older son wanting to go somewhere and Nathan's having a meltdown, or it's just your whole life. You can't even comprehend how much your life revolves around. If you just need to cut toenails and it becomes an hour-and-a-half ordeal because you need somebody to help you hold him down.
And how important has treatment been?
Oh, completely. Nathan is still on the severe end, and so he does progress, but at a very slow rate, even compared to other autistic children. That's where that spectrum comes. So it's just this huge spectrum. But when he gets that treatment, you can see it continues at a slow rate, albeit, but it does continue. It doesn't slip back.
All right, Sondra, if you'll bear with us for a moment, we're going to look at another clip. Dr. Carasso, let's talk about who we're going to see now. Her name is Brittany.
Yes, this is Brittany, and this is a great example of the spectrum again, in the sense that Brittany is quite high functioning in numerous respects. She's fully conversational, she's engaging, but she is within the spectrum, and she's diagnosed with PDD. So what we'll see is her very capable therapist, Susie, who's done a wonderful job with her, working with her in terms of eye contact, with fuller verbal utterance, and so we'll see. What we'll see actually is them seated at a table. They've just finished with a session of discrete trial therapy, which we talked about before, and they're having a conversation, and we'll see how it plays out.
All right, let's take a look at the tape.
What did we lose?
Our TV.
TV. Why? What were we doing?
We were watching.
Looking at Susie.
We were watching the news.
Are you allowed to watch the news?
No,
Why not?
because we have bad people on the news.
Sometimes bad things happen on the news. And are they for little girls?
No.
No. Mommy doesn't want you to watch that, right?
Yes. Mommy wants my different shows, like Disney Channel.
Say it again slower. I didn't understand.
Like Mommy wants Disney Channel, like Playhouse Disney. That's for little girls.
Playhouse Disney is for little girls. That's a good choice.
I'm a Disney Channel.
Disney Channel's a good choice. Yes. Mommy likes those.
I'm a Noggin.
Noggin is a good choice also. Mommy likes those also.
Let's talk about what we just saw.
Yeah, sure. One thing to take note of is how subtle some of those signs and symptoms were. Again, with the eye contact, and one may confuse that and think that maybe she's just being shy, but there's more to it than that. One may think that she just has some speech and language problems, but again, she's within the spectrum, and she's exhibited remarkable progress. One thing that's unfortunate is we don't have any before clips of Brittany, so we can't compare, but she has come a long way, and her progress is very encouraging, obviously for Brittany and the family, but also for children within the spectrum. It speaks to the fact that great strides can be made for many children. Of course, for some, Nathan, for example, progress is made as well, but as Sondra pointed out, it's a matter of maybe a smaller scale,
Right.
smaller steps.
All right, Dr. Lowenstein, the question comes up now, is there a cure? We see what treatment can do, but do we really have a cure yet?
No, there's no cure for autism. We can treat some of the associated symptoms of autism quite well, but we can't cure it at this point.
Sondra, do you still have hope that Nathan will continue to progress?
Oh, absolutely, absolutely. Sometimes with Nathan, what we absolutely do is we'll go back and look at old data sheets, that type of thing, just to remind ourselves, okay, it's frustrating, but he has progressed. When I look back 3 years ago, he couldn't do this, or this was a big challenge for him. And something, it's as simple as when he gets a haircut, he now does that plastic cape around him. And it took us 5 years to get to that point. But something as simple as that is a milestone for Nathan.
That could be major progress, as you see in a lot of the cases.
Absolutely.
All right, we're going to take a short break. Sondra, thank you so much
Thank
for
you.
being with us and sharing your story and Nathan's story. We'll be back with more questions for our doctors right after this.
a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
80.
30.
50.
Every mile brings us closer.
25.
Every mile in a city near you.
75.
Help us find a cure for diabetes.
100.
Join the Tour de Cure.
60.
Register to ride
36.
or sponsor a rider.
50.
Call 1-888-DIABETES or visit us online. The Tour de Cure. How many miles will you ride?
25.
Welcome back to Community Psychiatric Centers Presents All About Autism. A footnote to our previous segment, if parents were wondering, Sondra Cheek actually does work with parents. She is a parent liaison at CPC, and she can answer a lot of questions from the parent's point of view and work with you if you need any help from a parent's point of view, and that's very important. Let's get back to our topic tonight about autism. And Dr. Lowenstein, let's talk about the assessment process. How exactly does this work?
Well, the assessment process is quite comprehensive. It's very important to first get a good developmental, family, and medical history of the child from birth on. In addition to that, it's important to have a physical exam of the child and possibly to rule out such conditions as lead poisoning or other conditions which might contribute to the disorder or be diagnosed as the disorder. There are other tests which can be ordered if a child does not appear to be responding to a child's name. A hearing test would be in order to check out whether the child has a hearing loss. Speech therapy evaluations are very helpful to know where the child is in terms of their ability to communicate. And if necessary, it's important to do some other kinds of ancillary tests to rule out a genetic cause for a condition that might look like autism.
So it can be a little confusing. You really have to know what you're looking for. When you were talking about it, you have to rule out lead poisoning, all these other things. It's not a very simple process. This is very involved.
No, it's not, and there are a lot of conditions that can look like autism that are not. It's also important to get intellectual testing of the child and psychological testing to see where they are at the point of time that you're seeing them.
All right, Dr. Carasso, let's talk about some other things that we're going to be seeing in some of the upcoming shows.
Yes, we're looking forward to future shows. Looking at, we discussed earlier about discrete trial therapy. We'll be looking at that in the shows to come. Social-based interventions, as I mentioned, whether it be occupational speech and language therapy. And what we'll be looking at is not just the therapy itself, but the pros, the cons, the advantages, some pitfalls, things that parents can avoid, hopefully for the betterment of their child, as well as ways to optimize the service for the best interest of their child, by all means.
Now, you do a lot of different services, and you have a lot of different types of staff members available at community psychiatric centers. Kind of run over that for me, because I was very amazed when I saw the different levels and the different types. You had speech therapists.
Well, you know, in the video clip, you saw Susie working with Brittany, and she's what's called a therapeutic staff support worker, and she can work with Brittany in the homeschool community, providing intensive services to be able to be available to continually prompt for, again, the eye contact and the verbal expression. Brittany's consultant, Amanda, she develops the treatment plans, and we have outpatient therapists as well. And so wherever the child's at along the spectrum and whatever needs they may have, then we're prepared to provide that.
Why is that so important? And how do you go into, say, even schools, right? You will go into a school.
Yeah.
How does that work?
Well, it works in schools. It works because the schools require staff to work with a child to help him or her stay on task in the classroom setting or in other places within the school setting. It's very helpful for a child who receives this one-on-one attention.
I was watching when we were doing some other work at one of your centers in Monroeville, the different types of things that you have available to really bring children out, and that to me was amazing. Let's talk a little bit about, you have a playroom.
Sure. And the playroom serves many purposes. It helps to help the child to feel relaxed. We can also use, obviously, the play materials to promote verbal expression and play skills, to assess imagination, to assess their social skills with other kids in the playroom. Many things that we can do with that, definitely.
Dr. Lowenstein, I saw you in kind of what would have been a therapy session, just observing, and it was amazing to me the way that you were able to relate to all different ages of children. And so when we talk about community psychiatric centers, we're actually talking about reaching children who might be 2 years old to what age?
21.
21.
Yes, we'll treat children anywhere from 2 to 21. Sometimes we even treat adults. We have a bunch of parents that are in treatment as well, of children that are receiving services from us.
How important is that for parents to really understand what the child is going through and to be able to adapt to what it is the child is going through?
I mentioned before how much progress Brittany has made along the way, and one of the primary reasons for that is because her parents are completely on board and they utilize the strategies that are recommended, and that's vital. I mean, the parents have to be informed and working with the team, and the team has to be compassionate and empathetic to their needs, and working together, tremendous strides can be made.
Parents have a real tough time in the community when they have their children there, and they really need as much support and understanding as they can get.
And I would assume that's really hard sometimes because so many people don't understand what they're going through. They may look at a child who is acting out and think that this is a bad child, and so they really have a lot that they have to learn how to deal with.
What's so important, and we had Sondra here in the last segment, and her role is vital because she lives it, she understands it, and so when she's talking to a parent, there's a bond there and there's an attachment that can be difficult to obtain otherwise.
All right, let's talk about what is available for them. If someone has been watching the show and they want to get help, where do they start? What's available right now?
Well, you start with any number of ways of contacting us, whether it be through our website, which is there's a plethora of information there for parents. There's a parent link that puts them in touch with all the various interventions and strategies that they can utilize, as well as our toll-free number.
And the website, we're looking at it right now, www.cpcwecare.com.
Mm-hmm.
And that is a first stop if they have a lot of questions. And there's also a lot of information, I noticed, on the website.
Yes.
All right, both of you, we appreciate it so much. Dr. Robert Lowenstein, Dr. John Carasso, thank you for making the commitment to educate and to inform and to enlighten a lot of parents who probably desperately by now need this help.
Yes.
And we'll be with you for the next couple of weeks. And thank you for watching. We will see you next week on Community Psychiatric Centers Presents All About Autism. Good evening.